Hi, my name is Hannah Bender. I'm the Director of Educational Services at Medical Missions Outreach, and today I want to talk about how to manage diabetes in our clinics. Diabetes is a complicated illness that serves as one of the primary causes of morbidity and mortality in patients across the world. Additionally, 75% of diabetic patients battle this disease while living in low or middle income countries. These are our patients. Patients in underserved communities, whether in low-income areas of the U.S. or in developing countries, often struggle to manage their disease and can see diabetic complications such as neuropathy, amputations, infections, renal failure, and death. However, with access to medication, diabetic supplies, a plan of care, and an understanding of the illness, diabetes can be successfully managed. The goal of this video is to help prepare you as you manage diabetes in our clinic setting. Many of you are familiar with diabetes management in the US, but we'd like you to see some little nuances in treating in our clinics. The first thing that you can do to help you in managing diabetes for your patients is to prepare for the week. This can be done by watching our webinars. Hear about some of the diseases that you'll be seeing. Maybe you won't see many diabetic patients. If you ever go through a week without seeing a single diabetic patient, though, I will get you a gift card, so let me know. Pay attention to supermarkets when you go in as a team. There will be things that you may want to recommend for your patients. It may help you to see how much money it costs in that country. Are they able to get a Nepro shake if you're recommending something for high protein? Are they able to afford a bag of rice versus vegetables? What's the price difference there? These are things that can help you going into the week. Also, ask your interpreter as you're preparing. Interpreters are wonderful sources of information. I remember when I was serving in the Dominican Republic and my interpreter, Lori, mentioned to me that the bag of rice there is actually very similar to some prices of vegetables. I had patient after patient coming in telling me that they had no way of affording a vegetable, they could only afford rice. Naturally, I'm very sympathetic to that, and I was having a hard time doing my education until Lori mentioned that actually there are certain stores where they're very comparable in price. Being able to share that information with patients really helped in our overall care. The next step is interviewing your patient. As you interview your patient, there are some things to keep in mind. First, do they have a history of diabetes? Many patients may not have ever been to a provider. If they've never been to a doctor, chances are they could have had diabetes for a long time without knowing it. However, some patients do know that they're diabetic, and they may even know some numbers for you. They may throw out numbers like 5 or 6 when you ask them what their blood sugar usually ranges. If you're like me, this terrified me when I first heard that. However, in some countries, they use a different measuring scale to determine their blood sugars. Some countries use millimoles per liter. In the US, we use milligrams per deciliter. The difference of these two scales is about 1 to 18. The millimoles per liter will be significantly lower. A range of about 5 to 10 is actually a pretty good number in their scale. Some countries that use this scale are European countries, such as the UK. Other countries, such as Fiji or South Africa, that have heavy European influences, also use this scale. So just keep that in mind as you're asking those questions for your patients. So you've prepared, you're interviewing your patient. Now you're ready to make a diagnosis. It could be that the patient was coming in with symptoms of hyperglycemia and you want to diagnose it in our clinic. How can you go about doing that on an MMO trip? This is difficult. We're usually given 4 different ways to diagnose diabetes in the States. You start with a hemoglobin A1C greater than 6.5. Unfortunately, we do not test hemoglobin A1C at this time, although we may in the future. Other ways to diagnose diabetes, though, are an oral glucose tolerance test greater than 200, which, again, we don't typically do in our clinics, but the other 2 ways of fasting blood sugar greater than 125 is a diagnosis of diabetes. Also, a blood sugar at random with signs and symptoms of hyperglycemia can also be used to diagnose diabetes. So as you're ordering blood sugar testing on your patient and it comes back and it's 180, this is going to be a very important question to ask. When was the last time this patient ate or drank anything? Sometimes they may say, I only had coffee. Make sure to ask if they've put cream or sugar in their coffee. Other times, maybe they forgot that the girl in triage just gave them a lollipop and shot their blood sugar up before they came to you. Definitely ask these questions as you're moving forward to diagnose your diabetes. Once you've made the diagnosis of diabetes, you can go ahead and move towards developing a treatment plan. This again may look very similar in some ways to what you would do in the US. In other ways, it's going to look very different. First off, many times we may encourage our patient to check their blood sugar 3 to 4 times a day, once before every meal, once at bedtime. This is not going to be possible for most of our patients. In some free clinics, even in the US, we typically don't have patients check their blood sugars unless they are on insulin. Most of our patients at MMO will not be on insulin, so we can encourage them to follow up with their providers. And if there's a big change that we're looking for, we can also ask them to return to clinic later in the week if we're unsure of the one blood sugar test that was taken. The next step is exercise and weight loss encouragement. This is such a huge step for our patients, especially to encourage sustainability long after our team leaves. Some studies have even shown that exercise and weight loss alone can decrease the A1C of diabetic patients by up to 2 points. This is huge. Another way is diet modification. Please, please, please don't tell your diabetic patients to never again eat carbohydrates, rice, bread, sugar of any kind. It's all about balance. Telling a patient they can never have something will often cause them to be so discouraged they won't listen to anything that you say. But if you can encourage them to go from 1 plateful of rice to a half cup of rice with a meal, or 3 or 4 slices of bread to 1 slice of bread, you'll significantly help their numbers and also give them encouragement to keep moving forward. Again, use your interpreter for pieces of helpful advice of what's available in that area and what can help them. There may be some things that the patient asks about that you've never heard of. When I was in Fiji with a patient, they kept asking me if they could drink kava and what that would be. I had no idea of the effects of that on blood sugar or anything else. It turns out it's a somewhat narcotic drink that is mixed up there by grinding the roots of a plant. These are things, again, that are helpful to use your resources around you and make sure that you're giving ethical but also well-informed cultural information. The last step of planning the care for your diabetic patient is the medication. In our clinics, we do have metformin available. This is great because not only is this the first line of medication chosen in the US for diabetic patients, but it's also one that's very sustainable for many countries that we go to, as the availability is very easy to get metformin in other countries as well. Another great thing about metformin is that it does not cause low blood sugars as insulin would or some other diabetic medications. So this is very safe for our patients as we encourage them to start a medication. Usually the beginning dose will be about 500 milligrams daily at bedtime with their evening meal, or in the morning with their morning meal, and then increase to 2 times a day up to 1,000 milligrams twice a day. If you have any questions about what prescriptions to order or how to dose your patient, especially if you're a nurse on the trip, you will only be doing this in collaboration with an advanced medical practitioner, like a doctor, nurse practitioner, or physician assistant. So again, in summary, prepare for the week, interview your patient carefully, make your diagnosis, develop your plan of care, and please use your resources. Many trips have MMO tables specifically for education. We'll have either dietitians there, nurses, student nurses, or others who are well-versed in diabetic management and plans of care. We would love for you to refer your patients to those areas to go more thoroughly into areas of diet and weight loss management. I hope this is helpful as you go about treating your patients in our clinics with diabetes. Thank you.